my name is Tyra. The medication that I was given was Lispro, and Lispro is a rapid-acting insulin, and its common trade name is Humalog. And then the way that Humalog is given is subcutaneously, and the reason being is that in the subcutaneous tissue there are many blood vessels, and so that allows more absorption of the medication versus if the medication was given PO or through IV. And with insulin, regular insulin is the only medication or the only insulin that can be given through IV. And then the way that this medication works is that it is a hormone replacement, and this medication can also be given to type 1 diabetics who are, they don't have any of the beta cells, which is the insulin. So it is given for them, but also with type 2 diabetics who are insulin resistant. They do have the beta cells, but they don't work as efficiently as it should. And so this medication works with both patients. And so this medication just replaces the hormone of insulin, so that way it can lower the blood glucose levels for the patient. And then some specifics for taking this medication is that you want to make sure that you check the blood glucose levels before giving the medication. And this is just to determine how much of the medication should be given to the patient. Typically with insulin, a sliding scale is given, so that way it can determine how many units of insulin the patient needs. And then another thing with this medication is that you do want to make sure that there is food in front of the patient, and this is due to the onset time of the medication. The onset time is how quickly the medication works, and that is typically in 15 minutes. And then another thing to know about this medication is the peak time, but also how long the medication lasts. The peak time is the medication's maximum strength, and that is 60 to 90 minutes. And then how long the medication lasts is around 3 to 5 hours. And then you do want to just monitor the patient for any hypoglycemic episodes, and this could mean that the patient could have headaches, they're clammy, diaphoretic, so you just want to monitor them for any of those symptoms. And then just knowing how to administer this medication, and like previously said, this medication should be given subcutaneously, and then the injection sites for that could be in the abdomen or in the back of the arm. And then some adverse effects that can be experienced with this medication are headaches, nausea, vomiting, and then even allergic reactions. And then when you should call the provider is if you're experiencing any hypoglycemic episodes. So if your blood glucose levels are just way too low, and then you also do want to notify your provider if your blood glucose levels do not go down, so you're hyperglycemic. And then you also do want to notify your provider if you're noticing and experiencing any allergic reactions, and then this could be any type of itchiness, rash, difficulty breathing. You do want to make sure of that. And then just also noticing like any injection sites, if there's like any infection or anything. So that's why it's important to make sure that you do proper hygiene, and then also just making sure that you rotate sites as well. And this is my medication. Thank you.